And welcome into To Your Health. Well, I just celebrated an anniversary. Kind of a funny one because in 2003, I had 6 bypasses on my heart. One of the things that I had to do was visit my surgeon 2 weeks after having the surgery, and he expected me to be able to walk 1 mile. That was part of the rehabilitation. Today we have with us Sylvia Dunn, and you are the director of the Baptist Health Cardiac Rehabilitation Program.
Correct.
I got it all out. And it's expanded a little bit more since then because they really want to stay with you for at least 6 months, don't they?
Well, we have a program where we have our patients come in 2 to 3 days a week, and most insurance companies cover 36 sessions.
Okay.
So that's quite a good little while.
Yeah, that's
about
right.
12 weeks.
That's about, well, that's it, just about what we said there.
Yeah.
And what it really does is, the biggest problem I think people have is, I'm sick, I feel better, I go back into my old ways.
Yes,
And
absolutely.
the old ways can be brutal.
Absolutely.
Yes.
And with having a 12-week program, we're kind of cementing some new habits for you. Instead of, just a brief time where you're sick and then you go get surgery like you did, or
Yes.
and then right back to the old thing. You come see us for 12 weeks, and we kind of teach you how to exercise, how to eat, all those things, and it becomes more of a habit.
Yeah, the accountability factor, and our viewers, I don't know if you know this, but it takes 21 days for something that ingrained in itself in ours. If you move into a new house, you get a new job, you don't feel comfortable with it for at least 21 days. You're doing the beautiful thing because you're after those 21 sessions, or after 21 days, you've done the key word. You've got them into the habit of doing something.
Correct.
Yes.
Yeah. And they can see the benefit. If they come once or twice, they may or may not see anything, may not feel any different. But if they continue and do the program, we do assessments at the beginning of the program and at the end, and we compare them, and we show the patients, look, this is how you felt and how much exercise you could do when you started our program. And then at the end, we do those same assessments and show them how much they have improved. And usually they're just amazed that they have made that much progress because we do it so gradually, they don't even realize they're doing so much.
And we're in the month of February. February is National Heart Month. And I think that there's 4 things people need to do. Have signs that you're having a problem with your heart, then realizing what can be done, and then doing it. And then fourth and foremost is maintain a healthy lifestyle with your heart. And that's the key, I think, with what you do. You're looking at the healthy lifestyle for the heart.
Correct. That's our main goal, is get that lifestyle ingrained in our patients where they don't wind up back in the hospital.
Right.
And have other events.
And, obviously your department probably doesn't preach this, but I think you, with your background, and you said you had bypass surgery also, so, and it was kind of like me. When you have some signs that something's wrong, give them some advice. What should you do?
Be a squeaky wheel.
Yep.
If you think something is wrong, you know your body better than anybody else.
Yes.
Go to the doctor. Tell him what you're feeling and how you feel. If he doesn't listen, go to a different doctor. If you know something's wrong, get it taken care of.
And Sylvia, you said a key point. You know if something doesn't feel right. And so you just go at that point and get it done.
Yeah, absolutely. Get it done.
Yeah.
Don't delay, because if you delay, then there can be some bad outcomes.
That's right. And then obviously after you do that, what you're going to do is find out it's either going to take medication, and sometimes it's going to take just a simple stent.
Could be.
And then obviously then we get down to the big stuff.
The big stuff.
As you and I well know, is when they finally say, okay, there's nothing we can do here. You actually have to have the bypass.
Correct.
And I had mine in 2003. Things have changed immensely since that time as far as bypass surgery is concerned.
Yeah.
And I'm sure different ways of rehabbing have changed also, have they not?
Yeah,
There's some new techniques.
Yeah, we have nurses and exercise physiologists that would work one-on-one with you and design that exercise program and get you feeling better. Yeah.
Yeah. So, I mean, exercise, and you hit the key. Exercise physiologists, because you can't just automatically say, I'm going to do some jumping jacks.
Right.
You may be doing more harm than good
Right.
with what you're doing.
Yeah, we teach you how to exercise and what exercises to do.
You get into a good program.
Yeah, absolutely.
So basically, like in your case and my case, we start off by, we visit our cardiologist because something is bothering us with our heart. He does what he can do, and he finally, like mine, said, well, I'm hit this point, your next step is the thoracic surgeon. Then the thoracic surgeon is basically going to get you, I want to say, up and running to an extent, to where you're ready to go. Then you go back to your cardiologist, then he refers you to your service.
Correct. We have to have a physician referral for you to come. Now, if you've had an event that you think qualifies and you did not get a physician referral, all you got to do is give us a call. We'll take care of it. We'll get you in and get you started.
Okay. In most cases, your insurance is going to cover most of this because they do need to be able to do that.
Yes, insurance covers most of it. It covers either all or part. You may have a copay, but we would let you know that before you came.
And if our viewers want more information about your program over there, they can go to Baptist Health First.
BaptistFirst.org.
BaptistFirst.org.
Correct.
And we're putting that up on the screen. Don't listen to me, watch the screen. And then you can there'll be a link for cardiac rehabilitation in your program.
Absolutely.
Well, thank you for all the wonderful work you do.
Oh, you're welcome.
It's great. And I know you're working with a great organization.
Yeah, I love
Makes
it.
it fun.
Yes.
That's great. And just remember this, the ticker is there to keep ticking. So make sure that if anything feels a little bit out of line, get it treated quickly. And we'll be right back right after this.